Hey, good afternoon and welcome everyone and happy Nursing Week. Before we get started on today's presentation, we at ANBLPN just wanted to take a moment to acknowledge the passion, commitment, dedication, and bravery that you all have been showing over the last 2 years and continue to show. Throughout the pandemic and still today, you guys are the ones who have been facing the unknown as you're continuing to care for your clients. So, nursing is an incredibly rewarding profession, but it's also a very tough profession. And never has this been more true than in the last 2 years. So you guys have all been the backbone of the healthcare system, and we certainly could not be getting through this pandemic without the care that you all have been providing. Nursing is definitely one of the most respected professions in the world, and every human being on the planet has benefited from the care of a nurse at some point in their lives. So we hope that you know how much we respect and appreciate all that you're doing today and every day as you continue the good fight out there. So on behalf of ANBLPN, we wanted to just wish you all a very happy Nursing Week, and we wanted to thank you for all that you've been doing. So my name's Kathy Arsenault. I'm the practice consultant for the Association of New Brunswick Licensed Practical Nurses. So I did want to thank you all for joining me this afternoon as I present on nursing leadership, professionalism, and the evolving LPN profession, where I will be addressing the many changes that have been occurring in practical nursing over the years. And as you guys are well aware, there's definitely been a lot. And often when there is a lot of change occurring in a profession, it is met with some mixed emotions. So there's, a certain percentage that really embrace those changes. They're very eager to work to their full scope. And then we have those who might be very reluctant and would rather not take on some of these new responsibilities. And we also have those who are just sort of caught in the middle, who feel confused about it all. And maybe you're just left wondering, what does all this change mean for me? What am I allowed to do as an LPN? And that's when we often hear people say things like, well, that's not how we used to do it. So before we really get into this presentation, I did just want to launch a quick poll question to you all, just to get a sense of where you guys are all feeling right now. So you're going to see this question pop up on your screen. So it's just asking, how do you feel about the role optimization that's been occurring for LPNs in the workplace? And your responses are anonymous. I won't know who answered what. So if you could just take a moment and answer that, whether you're excited and you're really happy to work to your full scope, if maybe you're just kind of confused and you don't really understand your scope anymore, or if you're feeling very unhappy and overwhelmed and don't really feel like you should have to take on some of these new challenges. So I'll just wait a little bit to give you a chance to answer that question, if you wouldn't mind. The responses are still coming in. I'll give you about 5 more seconds if you want to just click off your answer. Okay, so I'm going to share those results with you now. So as you'll see on your screen, about 71% of you, so the majority of you are feeling excited about it and want to be working to your full scope. About 27% of you are feeling just a little bit confused and unsure, and just 2% of you are not very happy about it. So I'm just going to take that poll question down and we'll continue on. So thank you for participating. So that just gives a little bit of sense that everybody does feel a little bit differently about some of these changes that have been occurring within our profession. And often when we are experiencing all of this change, it can lead to issues with professionalism, because change can be hard. And when things get hard, we get frustrated. And that's when, unfortunately, a lot of people turn to social media to vent out their frustrations, or they start acting unprofessionally in the workplace. So my plan today is really just to talk about some of these changes, the importance of keeping your competencies up to date so that we are all working to our full scope of practice, and how we can all be displaying leadership and professionalism in our practice. So, sorry, I'm just having trouble with my mouse here. Here we go. So I am going to just start this presentation with a brief explanation of the role and the mandate of ANBLPN, because there's often a lot of confusion about this and how regulation is connected to your practice. So all nursing regulatory bodies have the same mandate, which of course is protection of the public through regulation. And ANBLPN really does not function any differently than any other nursing regulatory body. So we fulfill our mandate of that public protection in 3 different ways. The first way we do that is by setting the education standards. So we set the education standards for all approved and accredited LPN programs in New Brunswick. In order for you to obtain your education in New Brunswick, you had to have either gone to NBCC, CCNB for our Francophone members, or Olton College. So the education curriculum in these programs are meeting the national scope of practice. And we do that to support labor mobility, so that if you relocate anywhere within Canada, if you wake up tomorrow and you move to Newfoundland or Ontario or Alberta, you are going to meet those entry-level competencies of LPNs. So you don't need to take on additional education if you go somewhere else or write another exam. Another way that we fulfill that public protection is through the discipline process. So if a complaint does come in regarding an LPN's practice, we are obligated by law to investigate that complaint to see if there's any confounding evidence to support the claim of unsafe practice. So we do have a complaints committee as well as a discipline committee, and based on any evidence, they might make the recommendation on whether or not an LPN's license is suspended or revoked, or if the complaint gets thrown out because there's not enough evidence to support it. And then lastly, we set those requirements for licensure. So in order to maintain your license each year, you have to have a minimum of 1,000 active practice hours over the 5 most recent years, and of course, comply with our annual continuing competence program. So in short, regulatory authorities really exist to serve the public by promoting good practice, preventing poor practice, and we intervene when practice has become unacceptable. So I want to start by touching on how much the LPN profession has changed over the last few years, and that with all of these changes has come a lot of added responsibility and the need for leadership in our profession. So one of the first big changes is our prolonged specialized training. So the length of the PN program has changed a lot. So, originally it was a short little 6-month program, then it advanced to 9 months, then it was a full year. We had a short stint where it was an 18-month certificate program, but ever since 2005, it has been a 2-year diploma program. So the changes to the length of the program really reflects that LPNs are now obtaining a lot more knowledge. And of course, with that extra knowledge comes a lot more responsibility, which is seeing LPNs working more and more to their full scope of practice. So that's why some of us had to go back and do some mandatory upgrading like the Med-Admin or the Adult Physical Assessment course. And we did that so that we could ensure that all LPNs in New Brunswick have received the necessary education to work to their full scope. And as well, if you were relocating somewhere else in Canada, you're meeting those entry-level competencies. Then, of course, we had a title change. So we officially had a title name change back in 2002, where we went from being registered nursing assistants to licensed practical nurses. And that was done to support the increasing autonomy of LPNs and to match our counterparts across Canada. Oops, sorry. And of course, we have our code of ethics and our standards of practice. There's been a lot of changes and revisions over the years to those 2 documents. Our standards of practice just got revised again in 2020. So if you haven't seen your latest standards of practice, we of course do encourage you to check this out online. And our code of ethics is the next one that is actually currently being revised right now. So ANBLPN is sitting on a national working group to revise our code of ethics. So you should expect to see that new code of ethics coming out in 2023, because we haven't had a revision since 2013. So these revisions are being done to reflect, again, more leadership, accountability, and professionalism within the role of the LPN. Scope of practice and employer policies being lifted. I put these two together here because in all actuality, your scope of practice has not changed in several years. So a lot of people always ask us, well, why does the association keep expanding my scope? But we haven't actually done that. It's been the lifting of employer limitations that has changed, which is now allowing LPNs to work more to their full scope. So that again is why that leadership piece is so pivotal to LPN practice. So a lot of these things are new to your personal scope of practice, but not new to, your legislated scope of practice. Entry-level competencies, those were also revised just recently in 2019. You can also find that document on our website, and we've done a webinar on this one in the past as well that's also on our website. But those were revised to reflect, again, the amount of growth and change that has been occurring within the LPN profession. And then, of course, we have leadership. So we are seeing a lot more leadership from our LPNs, and we're seeing LPNs in these more formal leadership roles as well that we might not have seen 5 or 10 years ago. And if you go back and review those revised documents that I just mentioned, so our entry-level competencies and our standards of practice, you're going to notice that there's a lot more emphasis on leadership because it is an expectation of all LPNs, and leadership is considered an entry-level competency now as well. So even with just those few points that I just talked about, that's quite a lot of change and growth. And so for some of us who've been around for several years, that can be really overwhelming. And I do think there's a need to acknowledge that and to understand that, some people are going to require more support than others in regards to some of these changes. However, at the same time, as a self-regulated professional, we're all required to keep up to date with our competencies and comply with any of these changes in regulation and employer policy. So nursing is a self-regulated profession, as we know, and that means that LPNs are responsible for what they do, and they're responsible for what they don't do. And the reason that we self-regulate is to ensure that delivery of safe and competent care that's based on those principles that promote good practice, prevent poor practice, and intervening when practice has become unacceptable. Self-regulation, it's definitely a privilege, but with that privilege comes a lot of responsibility as well. And so what I mean by that responsibility is that we are accountable for our actions and our inactions. So that means that we make appropriate decisions, we're following employer policies, we're following any regulatory policies, because that accountability is really inherent to the role of the LPN. And of course, we do this because my practice is my responsibility. I say this in a lot of my presentations because I do think there's a need for people to really become aware that your practice and obligations are not the responsibility of somebody else. So it's not up to your nurse manager, it's not up to your regulatory body, it's not up to your team lead or your RN. You are the one that's responsible for your own practice and meeting your obligations as a self-regulated professional. So I can certainly think of a lot of examples within my profession where we see people trying to blame someone else for something that was their own responsibility. So a primary one for me that pertains to my practice area, of course, is the continuing competence program. And I know that at this time of year, I am not very popular. But that CCP program has been in effect for 5 years now. But every year we have people saying that they've never heard of it and nobody's ever told them about it, even though we've communicated that, across all the communication mediums that we utilize. But at the end of the day, we're the ones that are responsible for making sure that we're meeting those regulatory requirements and staying informed on what is required of us on an annual basis. So as we're moving along today, you should really start thinking about, or what I'd like you to start thinking about, I guess, is what does a leader look like? What kind of characteristics do they possess? And then maybe even ask yourself, what is my personal leadership identity? And so what I mean by that is that leadership identity, it's really about how you show up for work every day. So what's your attitude like at work? What's, your mental and physical presence? How are your interactions with other people? What is your willingness to take on some of these new challenges? Because if I was, in the same room with you today and I asked you, are there people on your team that you admire or perhaps you look up to? I'm sure that the answer would be yes, there would be somebody amongst the team. So what is it exactly that you do admire about them? Because often it's not their technical skills that you're admiring, but it's their interpersonal skills that you admire. So when I was conducting this full leadership course that we did, prior to COVID, in this pre-COVID world that we long for, we did break into groups to list, what characteristics made people a great team member. And every single time, the majority of things listed were interpersonal skills and not the technical skills, because that's really what leadership boils down to. It's not so much somebody's ability to insert that IV, but it was their ability to connect with their clients, having patience, having empathy, being a team player, mentoring other people. Those technical skills are obviously still very important for the job that we do, and they're necessary for the job that we do. But when we're thinking of leadership, it is more focused on those interpersonal skills. So if you do have someone like that on your team, maybe you can start thinking about how you can be that for somebody else. And I think that a lot of people believe that in order to be a leader, you have to have that fancy title at the end of your name of, supervisor or manager or director. But the truth is that we can all be leaders in our own practice environment, because being a leader is not tied to your title. It's more about how you're conducting yourself in the workplace. And that type of leadership exists in all forms and in all roles, despite what your title is. So how does that all tie into our standards of practice? So as I said, we do have new standards of practice that were released in 2020. And when you look through that, you'll see that it does have a lot more emphasis on leadership, professionalism, accountability in response to all those changes that have been occurring in our profession. So I just picked out a few to draw your attention to. So you'll see the first one is Standard 1, Professional Accountability and Responsibility, states that LPNs are accountable and responsible for their own practice, their conduct, and their ethical decision making. So we already talked about that. The second one is that LPNs provide leadership to support and or participate in mentoring and preceptorship. So again, leadership's listed here because it is part of your role as an LPN. It's expected of LPNs and it's an entry-level competency. And then the last one is Standard 2, that's based on evidence-informed practice, and it states that LPNs maintain relevance in their practice in response to changes affecting the profession. So that's a big one for me. We do have to remain relevant in our practice so that we can be responding to these changes that are occurring. So unfortunately, I do often hear from people who say, well, I'm just going to refuse to do anything more because I didn't sign up for this. Or they'll say, well, they don't pay me enough, so I'm just going to refuse until they give me more money. And probably all of you here today have heard comments like that. And that, of course, is kind of the opposite of leadership and professionalism. And I do often have to be quite upfront with people that you can't just refuse to do tasks if they are within your professional scope and they are an expectation of your employment. We all need to be working to full scope. So what exactly is leadership and why is there so much talk about it lately? So I think, this leadership, it's really become a bit of a buzzword in healthcare. But leadership, it's about critical thinking, it's action and advocacy. It's about inspiring and motivating others to act in some way to achieve a certain outcome. And it's about demonstrating professional leader behaviors for the purpose of successfully influencing client outcomes. So again, you'll notice that it doesn't say anything about your title because we all have that ability to demonstrate these qualities regardless of our role or where we're working. So let's talk a bit more about how all of these changes have created that need for leadership. And I chose this picture that you're seeing because I really think it should be quite evident that LPNs are no longer living in this little fishbowl, right? The profession has made a huge jump due to all of those changes that we're seeing occur within our profession. So some of those changes are, of course, we've had changes to the LPN Act, we've had some changes to our education curriculum, There's definitely been changes to our scope of practice and our entry-level competency, and there's been changes to our standards of practice and our code of ethics. So again, that's a lot of change. And as I said before, all of those changes mean that LPNs are taking on more responsibilities, and we're seeing more and more LPNs working in these leadership roles that traditionally we would not have seen years ago. So I want to take a closer look at some of these changes that I've listed here and what exactly does that all mean. So the first one, of course, is the LPN Act. And if it's not exciting reading, but if you've ever looked through it, it can be quite long-winded. And after you read it, you're probably left a little bit confused, like myself the first time I read it. But our Act defines an LPN as a graduate of an approved school of practical nursing who is not a registered nurse in New Brunswick, undertakes the care of patients under the direction and in collaboration with a registered nurse or duly qualified medical practitioner or pharmacist for custodial, convalescent, subacutely ill, and chronically ill patients. So what the heck does that all mean? Well, our Act was amended in 2014, and when we amended it, two significant changes occurred. So the first one being under the healthcare team that we work under the direction and in collaboration with, pharmacist was added to that group of persons, and that had not been there before. And that really helped open up the doors for LPNs as well, because that explains why you see LPNs, working in a pharmacy, giving the flu vaccine, and of course, giving the COVID-19 vaccine. Lots of you participated in the vaccine rollout because we are able to work under the direction and in collaboration with a pharmacist as well. The other significant change when our Act was amended was that under the client population that we care for, subacutely ill patients was added, and that had not been there before either. So that again is why we're seeing LPNs work in places like oncology, ICU, the emergency department, whereas years ago, it wasn't commonplace to see LPNs working in those areas. So those two amendments really help to allow LPNs to practice more autonomously and more to their full scope of practice. Another thing to note in our Act that is still, I find people get confused about, is that line under the direction and in collaboration with. That does not mean that RNs and LPNs have to be joined at the hip, or as some of you might recall, when I worked in the hospital, it was, you had to be paired with an RN at all times. And often there's confusion about this. So they don't always have to be physically in the building together, because that consultation and collaboration could happen via a telephone call, if your employer has a policy there to support that. Because if it meant that we had to be paired together all of the time, we wouldn't see LPNs working in areas like the extramural program. So we know that LPNs have their own client assignment within extramural. They're out in the community seeing their patients. They certainly don't have the RN riding around in the back seat with them as they're going to see their patients. But of course, they all have a phone, so that if they happen upon a situation where they need to consult or collaborate, they can call back to the office and do that. So making those two amendments did really start to open the doors for LPN practice. Then, of course, if we look at our education curriculum and how that's changed, so I often refer to it as the big three. So medication administration was brought into the curriculum in 2004. The adult physical assessment was brought in 2005, and the phlebotomy and the IV initiation was brought in 2012. So the MedAdmin and the adult physical assessment were those two mandatory upgrades for those that graduated prior to these years. And as much as we groan and we complain about them, it is really what makes us more autonomous practitioners, and it is what helps enhance our leadership abilities. And those changes really help support that labor mobility piece as well, so that again, if you're relocating, you're able to just get licensed and not have to take extra education. And so as that healthcare evolves, we really have to evolve with it. So our practice needs to evolve to keep up to speed, and some of those employer policies really need to be updated to reflect those changes as well. So all of these changes have really led to changes, as I said, to your personal scope of practice. And I say personal here because, as I said earlier, it's not so much that you're provincial scope of practice has changed, but it's those employer policies have changed, which is now allowing you to work more to your full scope. So it's new to your personal practice, but not the LPN scope of practice. And this is where a lot of confusion lies and where people are always calling us looking for a task list of who does what. But there is no proverbial task list that we pull out of the sky, because nursing really can't be defined by a set of tasks. So it's not like a grocery list where you can just start marking things down and crossing them off. So scope really can't be defined that way, because our scope of practice is going to look different for everybody, because it's going to be really dependent on when did they graduate, where have they been working, what kind of experience have they accumulated, have they taken more education since they've graduated. And we do have a document on scope of practice that has a decision-making tool that you might find helpful to look at to help you better understand that. But essentially, your scope can be broken down into 3 different levels. So at the top where you're seeing that little yellow circle, we have our professional scope. So this is what we legally can do as a regulated healthcare professional. So if I gave a really simplistic example, we know that as an LPN, we can't perform surgery, right? So legislation is not going to allow you to do that as an LPN. Then we have our individual scope, which is the little green circle there. And that's really dependent on when you graduated, where you've been working, what kind of experience you have, what kind of extra education maybe you've taken since you've graduated. So the scope of practice of somebody who graduated in 2018 is going to look very different than someone who graduated in 1996. And then lastly, in the blue, you have your scope of employment. And this is what has the biggest impact on your practice, because what interventions you're performing is really going to depend on what the employer is going to allow you to do. So on one floor, you might be performing phlebotomy, but then on another floor, you might not be doing that. So even though it's within your professional scope and perhaps even your individual scope, maybe the employer doesn't allow that there. So the key to knowing what you can and cannot do comes down to whether or not you have the education, you're competent, meaning you've done it safely before, and you're authorized, meaning that there's an employer policy in place to support that practice. So I just got done saying we don't look at nursing like a task list, but I am going to give you a little bit of a list here, only because we have had so many questions about optimizing the LPN role, especially within the nursing home setting. And we've had a lot of questions about LPNs assuming the charge role and what are they allowed and not allowed to do. So I'm just giving you not an exhaustive list by any means, but sort of the more frequently asked questions that we get are, can I do this as an LPN? So all of the things I list here, you are legislatively able to do this. So of course you can process and initiate all orders. So whether they're written, verbal, electronic, time limited, medical directives, stats, PRNs, and telephone orders are all within your legislative scope of practice. You can administer all forms of medication, so orals, tube feeds, subcutaneous, intramuscular, intradermal, intravenous, topical, vaginal, rectal, and inhalants. Of course, LPNs are conducting narcotic counts, they're verifying MARS, they can receive medications from pharmacy. You can phone the physician or the nurse practitioner to request an order. You can phone the pharmacist to verify medications. You can perform phlebotomy. You can initiate IVs. You can pronounce death, which is different than certifying death, so don't get those too confused. You may assume the charge role. You may document on the care plan, and you, of course, are collaborating on the initial care plan. You can take part in multidisciplinary meetings, and you can take part in rounds with the physician as required. So legislatively, all those things are within your scope, but you always have to remember, have I been educated on it? Am I competent to perform this? And am I authorized by my employer? So you need 3 green lights there. And we can, at the end, when we open it up for Q&A, we can talk about that a little bit more. So that brings us to professionalism and how that is tying into leadership. So when you look at the revisions that have been made to those core regulatory documents of the standards and the entry-level competencies, you will notice an increased focus not just on leadership, but also on professionalism as well. And I always say that nursing professionals study from the science and the art of health, because nursing is both a science and an art. So, and that professionalism is realized through those purposeful relationships that we're having with our clients and other members of the healthcare team. So if we were to define professionalism, we could say that it's an overarching term that includes our appearance, our behavior, our competence, and our job role. It's characterized by people who share the same values and a similar education, and it means that each person is accountable for their actions. So when we speak of these professional behaviors, it does include basic manners, and this is often referred to as civility when we go and look at the professional literature. The opposite of civility is obviously incivility. And when you go and look at some of the research, you'll see that it does mostly focus on incivility. So after looking at some of that research, it became really evident that there were certain themes that were regarding the impact that incivility has. So I wanted to show those to you now. So if you have incivility in the workplace, it has shown to have a negative impact on staff health, client outcomes, employer concerns, and the workplace environment. And I'm sure that you can all think of a time when someone's behavior in the workplace has either made you feel bad about yourself, or maybe it, put you in a bad mood, which in turn might have come out in some of your client care interactions, or maybe your interactions with your coworkers. So maybe you were too sharp with a client or a coworker, or maybe you just disregarded a client because you were frustrated. And that can spread so fast and lead to a really negative work environment, because that kind of behavior really does have a ripple effect among the team, which is what that little cartoon is showing you. So really, a reminder of our conduct at work can be simplified into this thought process. Be the nursing professional that you would want to work with, or that you would want to be receiving care from. Because I think when we stop and think about it that way, it can really change things for us. It really makes me stop and reflect on my own behavior, or perhaps somebody else's behavior, because I think we all want work to be a positive place. Nobody wants to be miserable at work, especially since we spend so much time there. We're definitely in very challenging times right now, which has not been easy for anyone. And I'm sure that a lot of us have had some sort of a moment because all that is going on around us right now. But it really is because of these challenging times that it's even more essential for us to maintain our professionalism, and that we remain civil with each other, because that teamwork is just so vital right now. So that's incivility. And if we talk about civility, what does that mean to be civil in the workplace? So civility is really just, it's an awareness of being polite. It does not depend on liking everyone. It requires thinking before you speak, which is a big one. And it might mean agreeing to disagree. So those are really simple actions that I just read out, yet it seems to be the hardest thing for people to do. It certainly doesn't mean that you need to be, going out every Saturday night for pizza and a beer with your coworkers, but it does mean that you have to be civil towards each other and communicate with each other in the workplace. So I am quite certain that there are times when you look at that schedule and see who you're working with ahead of time, and you're either thinking one or two things. You're thinking, oh dear God, I just need to get through this shift. Or hopefully you're thinking the exact opposite, and like, this is awesome. This is the best team ever. Somebody could code and we have got this. We're only human. We do not always get along, but we do have to remember to be civil with each other despite that. So I think we all need to just start embracing some of those strategies to improve our professionalism in nursing. And that, of course, includes being civil and polite. So if we all just start to take some sort of responsibility for our actions and our reactions, and we start advocating for that change in some small way, then there's going to have to be a shift to that increased civility and improved professionalism in our work environment. So is this easy? And can we all just change overnight and become leaders and the epitome of professionalism and just roll with the punches? Well, of course not. I do want to acknowledge that there's definitely some significant challenges to all of this. We're not so naive to think that this is just easy and everybody's just going to jump on board and roll with it overnight. One really significant challenge is just change fatigue. So I do think that it is a fair and honest statement to say that within the last 5 to 10 years, LPNs have quite literally been pummeled with some of these new responsibilities. We acknowledge that 100%. But we've also been advocating for this moment for a really long time. We've been wanting to see changes in our profession, which means, you know, we may also need to make some of our own changes now that we're here. And as I said at the beginning, some are really going to embrace these changes and be really gung-ho, which, you know, 70% of you are, while others are going to need some time and some mentorship to take on some of these challenges. And as I said, you can be granted some time. You know, you have a conversation with your nurse manager if you're one of the ones that's feeling very overwhelmed and uncertain, but you can't just outright refuse forever. Another real challenge to all of this is that we're now working with the largest multi-generational workforce in history. So in any given workplace today in New Brunswick, there could be upwards to 4 different generations working together. So that means that there's 4 generations who have different values regarding work and family life. They've got 4 different sets of expectations regarding what's acceptable or unacceptable behavior in the workplace. And I'm sure that you can all think of somebody on your team right now. And it can certainly be funny to look at some of these different characteristics. And I know that, you know, we can all think of someone who maybe has really challenged our ethics. They've challenged our values. They've challenged our patience at times. And, you know, it can really create a major source of tension for people in the workplace. So I think we can all admit that we've had moments where we've either thought or said things like, ugh, these millennials, they're just so entitled. Or you're on the opposite end and you're thinking, ugh, these boomers, would they just retire already? Why are they still working? And the truth is we react this way because we really don't understand each other, because we have grown up in such different social environments. And that makes us have different values of what we deem as appropriate behavior in the workplace. So that research has just repeatedly shown that workplace stressors and coworkers with different values related to work can really be a battleground for negative reactions. So that means that at times we really do need to pause and remember that just like the role of the LPN has changed, times have changed, and we don't all see things in the same way either. So we also have this very significant change of or challenge, I should say, of an identity crisis and role confusion. And this is the one that I think everybody can relate to and has felt one of these 3 ways at one point throughout their career. Because all of these changes and expectations, they can lead to that feeling of excitement, loss, or totally confused. So regardless of, you know, how these feelings are being labeled, they all do involve some sort of change. And that loss of identity really drives people to that nostalgic thinking and saying things like, well, that's not how we did it before. That's not how things used to be. So these 3 pictures, people are usually left feeling one of these 3 ways. So the one on the right, where we kind of go from Florence Nightingale to today's scrub nurse, that's that acceptance piece. So those are the people who are like, this is a good thing. I'm embracing these changes. This is an evolution of nursing. It's great. Then I think we have this little chaotic, frantic lady in the middle. And this is where I think a lot of people end up, unfortunately, where they're just totally confused. It just feels like chaos to them, and they just have too many roles. And they're just of that mindset of like, I don't even know what I'm supposed to do first. Am I emptying the bedpan or am I giving the meds? Because I don't even know what my job is anymore. So I think a lot of people end up there. And then lastly, we have our meowing cow over here, who is our confused, apathetic cow, in that, you know, they're the ones who say, I don't even know what I'm supposed to do anymore. I'm just going to go to work and do my job because it doesn't matter anymore. And that is really the most dangerous spot for people to be in. Because you've really lost that passion for nursing when you reach there. So we do aim to have everyone come around to that embracing the change and celebrate that evolution of nursing, but it absolutely takes time. And it can also be a culture change for people as well. And it might be a culture change, you know, on your unit, on your floor, or your workplace. So I just have one more poll kind of going back to kind of drawing on what I already asked you earlier. So I'm going to pop that up now. So where do you currently see yourself in these images? If you could just cast your vote there. Are you embracing it and accepting it? Do you feel frantic and chaotic, or are you the confused, apathetic, meowing cow? I'm not calling anybody a cow, by the way. So I'll just give you a few seconds to answer that. About 5 more seconds if you want to quickly just tap off your vote there. And again, I won't see who you are. It just comes in as a percentage. No names are shown. Okay. I think everybody's done answering, so I'll just show you those results now. So we are a little bit all over the place, which is expected. So happy to see that most of you at 81% are accepting it and embracing that evolution of nursing. We have 17% that are feeling a little bit like the frantic, chaotic lady in the middle. And then we have 2% that are just feeling very apathetic about it. So thank you for participating in that. Okay. So with all of those changes that we just talked about, that is why leadership and professionalism is so important to nursing. So research has definitely shown us that when we pair leadership and professionalism, we're going to see those more positive client outcomes. We also see healthier work environments when we display that leadership and professionalism. And, you know, if we think about it, if you have a colleague that spends all of their time complaining about work, they're venting on social media about how awful work is, they're speaking, you know, poorly about their clients or other staff members, how is that going to affect your shift, right? It's probably going to make you feeling frustrated, and you start feeling really negative about things as well, because as we said earlier, those kinds of attitudes really spread quickly amongst the team, and then the whole team becomes very negative, and we see that incivility happening in the workplace. So we do need to try and stand up to that negativity in a professional manner, of course, and start showing some pride and motivation in our practice. So when we show that leadership and professionalism, it does create pride in our profession, and it motivates other people to do the same. So for me, the worst thing that I hear from other LPNs is when they say LPN stands for low paid nurse. This certainly doesn't show any pride in our profession, and it really belittles the profession. So if you're putting that kind of language out there, that is in fact how other people are going to see you. And I don't think that's how we want to be seen. And lastly, of course, that leadership and professionalism is required in every position across all practice settings. It's not only reserved for formal management professions or positions, sorry. So as we're finishing here today, I did just want to leave you with some characteristics of professional presence. So that professional presence, it requires you to be accountable, ethical, and honest. It requires you to be respectful in your words and your actions, to be collaborative with the healthcare team, to be clinically competent. So again, we're staying up to date on those competencies, having a sense of optimism, which I know has been a challenge, showing compassion and empathy towards others. So if we're only viewing nursing as a task list, we do run the risk of losing that compassion in our care if we're just seeing it as a checklist of things to do each day. using professional language. So this has really taken a landslide in the last couple of years as well. And of course, looking professional. So we do need to look and act professional, but we also have to remember to be present with our clients as well. So I do want to thank you all for joining me today, and I just popped up some resources that you can find on our website just to make yourself aware of if they're new to you. So of course, I've talked about our standards of practice and our entry-level competencies that were revised. We have that scope of practice document that has the decision-making tool. We do have a document about professionalism and presence in nursing. And of course, we did just release a new one in April, professional use of social media. So if you just go to our website as an LPN, you're going to be spending most of your time under this members tab, and that's where you will find all those practice resources, as well as some past webinars that we've done, because we always record our webinars, so you can find those there. We did a two-part webinar series on professionalism last year that you can find there, as well as professionalism and social media, which of course is a whole other topic on its own. So I'll open it up for Q&A now. If you can try and use the Q&A box instead of the chat box, because it's kind of hard sometimes to toggle between the two. If you do have questions or comments, you always have the option to send anonymously. If you don't want me to see your name, you can send it as an anonymous question. But I do really want to thank you guys for joining me today. And I again want to wish you all a very happy nursing week. And I hope you're going to find some time for yourself this week, which I know is hard to come by. So thank you very much. So I'm just going to see if there's any